Let's bring the meeting to order of the Carver Finance Committee, 7 o'clock, June 9th. We'll start by Pledge of Allegiance. Okay, I pledge
allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. First thing we're going to do, it's not listed on the agenda, but we're going to look at the meeting minutes of March 19th, which I sent everybody out. And I know I have one correction, but can we have a motion to approve the minutes?
Do we have to make the change, or can we? Did you already make the change?
No, I didn't make the change yet. I want you guys to know what it is, but we'll first approve it, and then we'll.
Okay. I'll make a motion to approve the minutes for March 19th.
Okay. Yep. Tony, we got approval. Walter, second. Okay, up for discussion. I've got one correction to be made, actually under the Article 5, where it talked about Mr. Cullum making a, I don't have that, let's see. Let me bring this up. Okay. There it is. Under Article 5, it said, Mr. Cullum asked what the burn project was, and Ms. Solger explained. It was actually Mr. Macrina that asked what the burn project was. And two corrections. We gotta put Mr. Macrina in for Mr. Cullum, and in the line, there is no space between was and. So those two corrections. So with that being said, any other discussion on the minutes? Okay, all those in favor? To be approved with the amendment, with the change. Okay, aye. So, okay, so that's 3-0 unanimous. Okay. All right. Now, we are going to have three applications for grants tonight. One of the things that happened is they're a little bit late, so please excuse us for that. But at the same time, we had transition on the committee, and we've had some other issues come up. And we also had our budget reduced quite a bit. So instead of a $5,000 grant, we have 3 grants for $1,666 apiece. So let us first hear from Health Imperatives.
Good evening. Andrew, as I introduced myself earlier, I know that the town of Carver has been very supportive of Health Imperatives for a number of years now, I think dating back to at least 2015. This is my first town meeting here, so I'm not sure exactly the exchange of information that's gone on historically, but I'm happy to talk a little bit about the work that we're doing in the town.
So some of the work that you do and how it is beneficial to Carver residents.
Yeah. So if you're not as familiar, Health Imperatives serves 23,000 individuals annually from Brockton down across the South Shore through the South Coast and the islands. That's actually a 16% increase in the last couple fiscal years. We continue to serve and meet the needs of the most needy, often women and families that fall through the cracks of mainstream care. And those are the individuals that we work with and that we're improving the lives of daily, including up to 200 residents from the town of Carver. I believe in the most recent report that we submitted to the town, we served 180 residents of the town of Carver, including 133 young families, mothers and children up to 5 years of age through our WIC services, women and infants, which is a a food and nutritional assistance program. It provides education and outreach as well. More than 30 individuals from the town of Carver received care at our sexual reproductive health clinics, where individuals may go for STI testing, family counseling, screening, pregnancy exams, cancer screening such as cervical cancer. We also have harm reduction services for those that have substance use disorders. And there were two residents from the town of Carver that also received services from Health Imperatives this past year through New Day, which is our 24/7 rape crisis hotline that provides assistance, advocacy, both for law enforcement and healthcare and support groups for those individuals. So we're seeing an increase of needs in the community. We are serving more people, and I believe there's an increase from 2023 to 2024 in the residents of Carver that we serve. I believe something like a 14% increase, and we will continue to serve the population the best we can.
Okay, any questions?
No, I mean, we're familiar with this from previous years. And
Yep.
the question I always ask is how many residents of Carver? I think that's what we were looking for, so
Great.
that's great.
Okay, so then can we have a motion to approve the grant?
So I'll make a motion to approve the grant for
$1,666.
$66 to Health Imperatives.
Okay, second by Walter. Any further discussion? Okay, all those in favor?
Aye.
Aye, thank you. Now what I need to ask you to do is to please email me directly an invoice for that amount,
Okay,
and then I'll process it.
okay,
All right?
we will do.
Fine.
All right, well, thank you for
Thank you.
Thank
your
you.
support and partnership.
Thank you for coming.
All right, thank you, gentlemen.
Take care.
Okay.
Bye. Ray? No? This is
I'm
Rick.
Rick from Social Arena.
Rick. Okay. You're early, but that's okay.
Alright. I did create 3 folders for you,
Okay,
just so you had some information like reading.
okay, good.
Thank you.
Yeah, no problem.
Good. I did share grant pages from each one with everybody, so, but please,
Sure.
thank you for coming, and please, go ahead.
So, South Shore Visiting Nurses was certified in 1966 as a home health agency. It has since grown to Massachusetts' largest Medicare certified home health agency and consistently earns high patient satisfaction. So Carver residents need accessible quality home health services that, in this grant, will help us essentially with in-home care, ensuring residents receive medical and personal support where they need it the most, which is their house. Many Carver residents face mobility challenges, chronic illnesses, aging-related health issues. With proper home health services, hospitalizations, without those proper home health services, hospitalizations increase and families struggle with their caregiving needs. So the grants will help us. What it is healthcare, obviously costs are expanding. So it's harder and harder for us to provide care when people can't afford it. So the grants help us offset those costs. So we provide skilled nursing care, physical therapy, medication management, caregiver assistance. We help residents maintain their independence while receiving necessary medical attention. Every dollar is strictly used for services benefiting the Carver residents, ensuring improved healthcare access and support within the Carver community. Enhanced home health services will improve residents' well-being, ease the burden on families, and create a healthier, more resilient Carver. So we offer in-home skilled nursing visits, physical therapy and occupation, medical management, home-based outpatient therapy, which is a new program. So that's like, home health requires that you're homebound. So outpatient therapy is more, you hurt your knee and they want you to go to a clinic. But maybe you feel more comfortable getting therapy in your house. We can now provide that without having a homebound status. So you just call your doctor and say, I want a therapist to come to my house. We can provide that now. And we have home health equipment and supplies, which is also included. And then South Shore VNA is the only VNA or home health services in Massachusetts that is certified in pediatrics. So we do oncology for younger kids, and then, but no other home health does pediatrics. So we have a huge thing, and we work with the Make-A-Wish Foundation, and we work with the Children's Hospital. So we provide all that care. So
Excellent. You guys based out of Abington?
we're based out of Rockland.
Rockland.
Yeah.
Any other questions?
Nope.
No?
No questions.
Okay, so could I have a motion to approve the grant?
Make a
Okay,
motion that we approve the
Okay,
grant.
Walter approves, Walter makes the motion, Tony second.
Second it.
Any further discussion? All those in favor?
Aye.
Aye.
Thank you so
Grant's
much.
approved.
Thank you.
So I need you, if you would please, to email me, do you have my email address?
I do.
Okay.
And thanks to you, I corrected my business card. It was,
Okay.
it was missing a letter.
It just kept bouncing back, and I just said, wow.
Yeah, it's 2 L's, not 1.
I said, I know I did this right. So, in any case, just, as soon as you can, just directly email me an invoice
Okay,
in that amount, and I'll approve it for payment.
perfect.
Good? Good.
Thank you so much.
Thank you, Rick.
Thank you, guys.
Okay.
You got somebody else coming in?
Yes, we do. I think they're here. There was somebody out there.
There he is.
There we go.
Good
Come on in.
eventually, madame, with,
Yeah, we're getting through these quick, so you can.
Yeah,
come in.
we're running way ahead of time. Ray?
Oh, are you ready for me?
Yes.
I stand or sit or
You can, whatever you'd
Whatever
like.
you feel comfortable with.
I'll sit down?
We are, yeah, you can just tell us a little bit about your organization. And like this, I was, just so everybody understands, we were a little late in getting people in for the FY '25 year transition on the board and different things. And our grant budget has been reduced significantly, but we still have some. That's why instead of a $5,000 grant, each grant is now worth $1,666 for what we have left. So, in that respect, with that out of the way, Ray, we can, feel free to tell us about your organization.
Sure. So, South Coastal County's Legal Services is the legal aid provider for southeastern Massachusetts. We cover Bristol, Plymouth, Barnstable, and Islands is our service area. We're one of several legal aid programs throughout Massachusetts that provide such services. And we get funding from several sources, but I think going way back to before I even started here, and I originally came to work for the legal aid program that was just for Cape Cod and the Islands at the time and part of Plymouth County. We've gotten grants from a lot of the towns in our service area, so both on the Cape and in Plymouth. It's kind of fallen off over the years, but we still pursue them when they're available. And I think it's been helpful in all these years of not only does it provide us a little extra resources to help people in your town, okay, but it's created kind of a connection. It brings us back to this town to meet. I think the towns that do grant us money know of us more, that we're more available. We get better referrals, I think, from towns that give us grants. So I always found it's kind of a unique opportunity, and especially in the Cape and Islands area and the Plymouth area to pursue these grants from the towns that are willing to do so. But our services are at no cost to low-income and elderly residents in Carver and throughout southeastern Massachusetts. And our program, from the grants we get, funds attorneys that are hired by our program. So it's staff attorneys and paralegals and support staff, okay, that represent actual clients in their civil legal problems in this particular area. So we don't do any criminal work. That's for public defenders. Our work is civil. People have to be low income. For us, that's anybody at 200% of the federal poverty level or lower, or elderly, and that's anybody age 60 or over. And we don't have a means test for elders, okay? As long as they're over 60 and have a civil legal problem, they're technically eligible for our services. We also kind of designate our services towards the area of greatest need. So the types of legal problems that low-income people, where they really need an attorney and, because they can't afford one, would really help them to have access to an attorney. And it kind of promotes the overall concept of equal access to justice. Our justice system works when everybody can equally be presented their matters before the courts. And if one side is represented and another party is not, it's oftentimes an unequal balance. Oftentimes low-income people can't afford an attorney and they go into courts unrepresented, and it's kind of an unfair system. But by government agencies and different funders providing the funding for legal aid, people who oftentimes can't afford an attorney can get an attorney to represent them in court. So, like I said, these services are focused on legal problems that poor people often face. So we see, and we conduct studies every few years to see what the greatest civil legal needs are for clients. So, but we've kind of remained true to a lot of the areas where we practice. So we do a lot of work in housing courts, okay? So when I say housing court, there is a housing court in southeastern Massachusetts where a lot of cases sit, but some housing cases can go into district courts, but they can easily be moved into the housing court. But people faced with losing their home, either through eviction, maybe sometimes through foreclosure, the last stage of the process is oftentimes that they're being brought into court for like a landlord to evict them or something like that. And it's very difficult for a low-income tenant to afford an attorney to maybe defend them and protect their rights. Our program provides them attorneys that go to court with them and help maybe stop an eviction, or at least provide maybe additional time or negotiate a settlement that gives them time to more successfully transition out. But there's been a lot of programs in the Commonwealth over years to help people like with non-payment issues. There's something called the RAF program now that can provide back rent, funds from the Commonwealth, that where somebody's being faced with eviction for non-payment, they can get funds from the RAF program to maybe prevent the eviction. There's different agencies that provide the RAF funds, but we can oftentimes advocate for the client in getting the application, cutting through the red tape and getting those funds, and then using those funds to prevent an eviction when they're in court. We do a lot of work in the probate and family courts, okay? It's kind of a difficult situation for a lot of people when they're facing divorce or separation and having to deal with children and child support issues and custody issues. So primarily we try to focus our attention on victims of domestic violence, but we generally represent people in probates and family courts through divorce actions, custody actions, attempting to give people protective orders, protection from abuse orders. Again, not something that's a type of legal problem where somebody has easy access to an attorney. If you're low income, you probably can't afford to have an attorney come with you for one of those types of proceedings. There's really not some type of pot of money that an attorney can get a fee out of. So either pay an attorney or don't go, or come to legal aid. And legal aid, again, will assist people in the probate and family court proceedings at no cost to them, and they get full representation. A lot of people are trying to access certain types of public benefits that are available to them, Social Security disability benefits, or SSI, different welfare benefits, cash assistance, food stamps, called SNAP, trying to get mass health. Oftentimes when people apply for those benefits, their application gets denied for different reasons. But they have a right to challenge that denial and go through kind of an appeal process, and it's an administrative process. But oftentimes it's helpful to have an advocate who knows the procedures and the laws, okay, about what makes somebody eligible or not, and to argue with the other side about maybe their decision to deny the benefits wasn't correct, and convince an administrative agency that maybe this person was entitled to the benefits. And so we do a lot of work with public benefits and assisting people take on administrative agencies and trying to get maybe benefits that they could be eligible for. With elders, there's probably other services we provide, like transactional types of things, helping people with healthcare proxies and powers of attorney. And first, our program provides certain estate planning clinics, oftentimes with the help of private attorneys who do estate planning, but they volunteer their time for our program, do pro bono work. So we coordinate efforts around the region for private attorneys to match up clients with private attorneys willing to do work pro bono to kind of reinforce our efforts and provide more resources to us. And so part of our effort is also to coordinate things with the private part and do pro bono work for certain clients. But one of the helpful things they've done is we've had several clinics throughout the region for estate planning clinics where elders can come in and learn a little bit about planning for their retirement and future of their estate through these clinics. And again, elders age 60 and over can get our services without having to pay for the services. And they can get assistance for all the other areas where we normally would practice, such as, they have housing issues too. Elders just oftentimes can be evicted and need help with that, or have family issues, or are trying to apply for different benefits. Medicare is a common problem where people have Medicare health benefits, but sometimes it's covered, sometimes it's not. They don't really understand when they're covered or not covered, or missed out on coverage. And there's a process where people trying to get Medicare can appeal decisions made by it's the Social Security Administration that oversees the Medicare program, but we can challenge decisions made by their Medicare benefits when somebody's being denied a benefit, or something where maybe they should have gotten coverage, and convince the agency that this person should have been covered, or they should have gotten this Medicare benefit. And oftentimes, without our advocacy, and it would be there on their own, not understanding, or the recipient would be on, before an administrative agency on their own, not knowing the law, not knowing how to make their argument, how to have themselves heard. So I think it's a really helpful benefit to a lot of people, again, to have advocates willing to help them with these types of legal problems. And again, we're the only organization in the region that does this type of work, and we benefited residents for the town of Carver throughout this process. Legal aid organizations have been around since the late 60s, part of the war on poverty when the first funding came in for legal aid. And so we've been in the region under different names, but now South Coastal Counties Legal Services, going back to the late 60s. I would say in the town of Carver, we get anywhere from 12 to 15 clients every year providing services. Average case is 5 to 10 hours. Figure the current rate for an attorney is at least $250 an hour. The grant helps us in providing that assistance, and we're grateful for the assistance that towns are willing to give us. And again, I really think in the towns that do give us grants, it does promote a certain connection of our services with that town, and people in the town are usually more, the government centers are more familiar with who we are and can refer people who come to us because they're aware of us. So I think it's a good arrangement oftentimes for these grants, and so throughout my time working here, I've helped our organization pursue these grants, and we're grateful to the town of Carver that you're offering this opportunity, and we hope to continue our relationship with Carver. And $1,600, I think you've cut the grants, but I think it helps people, and that's what we're trying to use the money for, to help people in Carver. That maybe we could represent a few, but with the grant, again, focusing on Carver, I think we do get to more people in Carver than otherwise. So that's our pitch.
Okay, it sounds good. That legal troubles can be unbelievable.
Yeah. And very costly at times.
Yeah, that's great service. Thank you. Any questions?
So the majority of the people will reach out from. Generally, it will be referred from the town to you.
Well, they can. I mean, we advertise in some fashion, and people can just call us directly themselves if they feel a legal problem. There's most public benefits when people get notices that by the government agency that something about their benefits is being affected, they usually have a referral that if you need legal help, call South Coastal
Okay.
County's Legal Services. The housing court has flyers in at their clerk's offices that if you need legal help, call South Coastal County's Legal Services. Now, we also have this time with the housing court now where we do what we call lawyer for the day, that our attorneys are once a week, either at the courthouse or through a remote meeting, where clients come to the court looking for help, and the clerks won't help them. They say they don't provide legal assistance, but now they can refer us, the person looking for some questions being answered and a problem, to lawyer for the day, and they can just get in touch with our office right at court locations or online, okay, to have legal questions answered and assistance. So, and we do that also. I mean, besides full representation, which probably the bulk of our work, we do a lot of cases where the person just needs some type of answer to questions, counsel and advice. So we call it a brief service, where they call up and they're not sure about this or that, or what law protects them, and an attorney can talk to them and talk about different strategies they may have to use to get a certain outcome, a legal outcome of some kind. There's different levels of service that we look at the case and what can we provide, what's best for that client. It's often client driven. They have an opportunity to talk to us and work with their attorney to see what's best for them. Okay, and most of our work is client driven. It's to serve what the client needs and what the client wants, and to help the client as best we can. So.
Do you have to, like somebody calls you standing in the courthouse, do you have to qualify them before you can actually
Yes.
give them?
Right.
Yeah.
They have to be, we have to, so, but we have a system now, like you said, lawyer for the day, people just come to the office and they get referred to us, but we usually have somebody like me who has a paralegal with me at the time, and the paralegal goes through the intake process, they just need to verify what their income is, or,
Sure.
the size of their household. Sometimes we need evidence of their income if they're employed and stuff like that, but for a lot of them who are on different forms of assistance, we know what the levels of assistance are, and so when somebody says, I'm getting SSI at this amount of money, we know that's the correct amount, and, just gotta answer some questions, and again, we have to determine what the legal problem is. It's gotta be civil, it's gotta be something in our priority areas, but that's the extent of the intake, really, and somebody calling us from a referral from the clerk from the housing court. It's usually got a housing issue. They're usually a tenant so it's just a 15-20 minute process of doing the intake and then providing the legal assistance.
Anything else, Walter? All set? Okay. Do we have a motion to approve the grant request?
I'll make a motion to approve the grant for $1,666 to South Coastal County Legal Aid.
Services.
Okay.
Legal Service.
Second by Walter. Further discussion? None? All those in favor?
Aye.
Aye. And we thank you.
Well, thank you.
Thank you very much.
If you
Appreciate it.
can email directly to me at your next convenience an invoice for that amount,
Okay.
I will process it,
Great.
and then you'll get a check.
Right.
Okay?
So we've emailed already, right?
Yes, we have.
Your back.
Yes.
You should see
Right.
me, but okay.
Good.
Yeah, we'll do that
Good.
right away.
Good. Thank you again.
Thanks.
Take care.
Thank you.
Okay,
Thank you
bye.
very much. Have a good night.
Okay, that was good. Those are our 3 grant applications that we had. And what I want to do is, anything further from anybody, comments, questions?
Did we have did you say you were gonna have another meeting set? that you
Well,
thought we were gonna have? Might be
We-
jumping ahead.
We got that right here on the agenda. Next meeting date is, we're gonna meet on June 25th.
Okay.
That's a Wednesday night.
Do we have something going on?
That's gonna be, an important meeting, because we're gonna be getting an update from the finance director as to the status, the year-end status of the accounts and so forth. We're also gonna have requests for the Finance Committee Reserve Fund, of which we have had none yet. But I know there's one sizable one that's coming, and there will be probably 2 or 3 more. The town administrator will also be there. So yeah, and that'll be our final meeting of the fiscal year.
Okay.
So with that, anything further from anybody? That was quick. We have a motion to adjourn. Okay, motion by Walter, second by
Second.
Tony,
Adjourn.
and all those in favor?
Aye.
Okay, we're adjourned.